Welcome to the Friends of NPACE Podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com. Hello and welcome back to the Friends of NPACE podcast. My name is Josh Plotkin. I'm the Chief Operating Officer at NPACE, and today I am thrilled to be joined by Richard, who is the Director of U.S. Medical and Scientific Affairs and Pain Relief at Haleon. He's a PharmD by training, and he's worked in pain management for over 20 years in the pharmaceutical industry, as well as a hospital pharmacist. Richard, how are you today?
Hey, Josh, I'm great. Thanks for having me on today for the great introduction, and good to be here with NPACE.
Excellent. Richard, we're thrilled to be with you as well. Richard, you work at Haleon, which is a fantastic company, and let's sort of start here. And for those who may be unfamiliar with Haleon, can you give some background on the company and the products that you have?
Yeah, sure, Josh. And it's not surprising that some people may have heard of Haleon because we are a really new company. We previously were the consumer health division of GSK Consumer Health, and there was a decision made to spin the company off and create a new standalone company, and that was Haleon. And that occurred in July of 2022. We launched, and now we are fully standalone, and we're one of the leading consumer health companies in the world with a very well-established set of products, which is one of the nice things that being spun off rather than starting from the ground up. We come over with products, some of them who've been around for over 50 years. So feel like we can deliver our objective, which is deliver health with humanity, to really do good health options and really do it the right way. So look forward to talking about what we can do in this important topic of pain management today.
Excellent. And when we learned about this, NPACE was extremely excited, myself as well, as before COVID, NPACE and GSK Consumer Healthcare had a great relationship, and now we're thrilled to have you back and to be working with Haleon. And can you give us some insight into the products that are within the Haleon portfolio?
Yeah, Josh, glad to do that. So besides the products we're going to talk about today, which are some of the leading pain products like Advil, Voltaren gel, Excedrin, and a product called Panadol, which is big outside the U.S., just available in Puerto Rico and the U.S. We also have other leading categories like wellness, oral care, digestive health, cough and cold, allergy, smoking cessation, and topical dermatology, and others as well. So quite a broad portfolio of established products, and pain is one of our core functions and therapeutic areas.
Absolutely. And we're about to jump into the pain management portfolio at Haleon. But before we do that, just one last thing to wrap up. You have some name brand products that both providers and patients are familiar with. Can you just give us some of those names that folks may find Haleon products in their home?
Yeah, and it's I think exactly that. People are going to be surprised, how many of our products they do have in their home. Tums is one of our big ones. Again, been around for many, many years and a leader in heartburn management. Sensodyne in the oral care category. Centrum, Flonase, Emergency. So really a broad range of good leading products that are key support areas in the therapeutics that they sit in for people who need to manage some of these conditions.
Excellent. Yeah, as you mentioned, there's a very high likelihood that folks probably have some sort of Haleon product in their household, which is fantastic. But today we're going to dive a little bit further into the pain portfolio at Haleon, and want to start here, Richard, which is the topic of our discussion, and how pain is categorized. And can you tell us a little bit about Haleon characterizes pain?
Yeah, and I think importantly, pain is such a key area for people because it's something we're all going to experience at probably multiple times throughout our lives. If you think of pain, it's a noxious stimulant. It's something that you don't enjoy the experience, but it has a message in that it's warning you that you have an injury or a condition that needs to be addressed. Um, so it has a value, but it also has that disruptive effect that we want to manage and treat. So if you think about pain, there's many different ways it's characterized or key characterizations. That includes the duration. So you have acute pain, which is up to 3 months. And then you have chronic pain, which is anything that goes beyond 3 months. And then when you think about acute pain, it usually has a pretty defined causality, and it's usually more localized. So, as an example, if you think about an injury, maybe you're playing a game and you get hit with a ball or somehow get injured. It's localized and you know what caused it. So it's a little more maybe straightforward to manage it. And then if you think of chronic pain, it's a little more maybe not as clear. It can usually be things that are spread maybe a little more broadly across the condition across the body with things like fibromyalgia, arthritis, where it has a broader impact and maybe not as easy to directly manage and treat. And then it also, you're not always aware of the cause or how it developed or how long you've had some of those kind of chronic type pains. But obviously, both the acute and chronic are a significant impact in people's quality of life. And if you think about Haleon, the conditions that we treat are really those that fall into that acute pain. And, we talk about up to 3 months, but really we're meant to use probably the first 10 days that you have those conditions on your own. And there's really good information on the product. There's something called the drug facts label that gives you all the directions, the warnings, kind of everything you need to know right on the box to get you started and use that safely and effectively with the directions available. The 10-day period is usually something you can manage on your own, but if you're not getting good benefits, the recommendation is then to talk to a healthcare professional like a nurse practitioner or any of those accessible healthcare professionals to get some direction on, are you using the right product? Should you continue using it? Is there other things you need to do to evaluate your condition?
Excellent. And as you mentioned there in your great explanation, pain management is a complex sort of thing to treat and be able to navigate both as a patient and a provider. And so when you're choosing between OTC, which is over-the-counter pain options such as Advil, and the potential for needing to employ opioids potentially, the CDC recommends that NSAIDs and other non-opioids as an option to use prior to opioids. And Richard, I was hoping you can help us highlight the CDC guidelines for pain management, especially given the entire opioid epidemic that the country has faced. So if we could dive into the CDC guidelines in context of our conversation today.
Yeah, no, that's a great topic to highlight as far as a discussion on pain. So this is a really important document for people who work in the healthcare space, particularly, which I think most of us do have at some point managed pain. It's a guideline that came out also in 2022. So same time Haleon launched, the guideline came out. So it gives us a good foundation for pain management. And importantly, it has two key focus areas, and they have 12 key recommendations. The first two are in the one area, which is should you even be using an opioid, and what are things that maybe you think about or try before you progressing to use an opioid. So that's really where some of our products potentially would fit in as being considered and potential options first line before maybe you would need an opioid. And some of the information you need to help you make that decision is in those two first recommendation sections. And then when you get by those into sections 3 to 12, that's really where you've made the decision, or your healthcare professional, like a nurse practitioner, has made a decision that you need to be treated with something more severe or more geared for moderate to severe pain with something like an opioid. So those last 10 recommendations really give you a lot of key information, things to think about, selecting the right opioid, understanding the benefits as well as the risks and how you manage those, things that you want to ask a healthcare professional to understand their perspective in them. So it's a guideline targeted for healthcare professionals, but it's the kind of information that consumers or pain sufferers are going to be asking the nurse practitioners and other healthcare professionals. So it really prepares you for those discussions and how to navigate the pathway to effectively use opioids.
Yeah, and we know that, from time to time that opioids are going to be a treatment option that needs to be employed, and certainly following the guidelines that you mentioned there. And we'll include a link to those guidelines in the podcast description. Folks can find that right there for them. And so following those guidelines and eventually getting to the opioid pain treatment is something that you can find as a part of that. But today, let's dive a little bit more into the non-opioid treatment options that specifically come from Haleon. Can you dive into those, Richard?
And one of the important things before you go to drug-based therapy is to consider pharmacologic, non-pharmacologic options. And these can be a broad range of activities, things like physical therapy, walking, light exercises, behavioral modification, and other things of that type. But then when you're looking to move into the pharmacological space, the non-opioids include both those that are prescription and the non-prescription. So if you think of the non-prescription, that's the OTC space that Haleon plays in. And we have a lot of products that are indicated for first line for very commonly encountered pain type conditions. So if you think about and look at the back of your package when you're picking up a product for pain, the key things you'll see is indications like headache, toothache, backache, menstrual cramps, common cold, muscular aches, arthritis, and migraine. And those are, the really big common types of pains that OTC products are indicated for first line.
Excellent. And cost-effective products there that are able to help with that. And specific to the Haleon pain portfolio, I'd say let's sort of dive into that further and specifics for Advil.
Yeah, so great question. And I think you highlighted some of the key things. These are self-care products, so very accessible and affordable type options that you can get in your pharmacy. And the nice thing is in the pharmacies, you have the pharmacist, and a lot of times you'll have the clinics where you'll have nurse practitioners and other healthcare professionals. So you have a lot of good resources both on the package, and then you have good resources with the healthcare professionals who are there. But Advil is a great product for us. It's kind of our every type of pain, those indications that I just went through. Advil has all of those on its indication, and it's been studied in all of those different indications. So it's what we call evidence-based, where there's, as a healthcare professional, you could look up and review these studies and have that evidence at your fingertips to help you make a decision if it's the right product and there's really support for it to work. So, and within the Advil brand, we have Advil PM, which combines ibuprofen, which is the active ingredient in all of the Advil Pro products. It's an NSAID, very effective option. And then it combines it with diphenhydramine, which helps you get the sleep benefit. So if you have pain with sleeplessness, Advil PM is a great product. We have Advil Dual Action, which combines two of the leading individual pain relievers, which are ibuprofen and acetaminophen, and they're combined in a fixed dose combination. So you get the benefit of two different mechanisms of action in one single product. And so the nice thing is you get better efficacy with the combination than you would with the individual ingredients in there when used alone. And then you also get lower exposure to the drugs, because by combining them, you can use lower doses than you would if you were using them individually and still get a good benefit with the two mechanisms, but less exposure to the medicine for people who are kind of looking with that approach. And one of the things that's really relevant for Advil Dual Action is the American Dental Pain Association dental pain guidelines. These guidelines outline treatments that should be used for dental pain and positioning for when they should be used. Importantly, Advil Dual Action's formula is considered one of the first line options. And they include an algorithm that defines how you use it within the treatment space and other options that you should also consider. So another important thing to consider with Advil Dual Action beyond the efficacy benefits is the exposure that you get with the product. And it's important to know that with the maximum daily dose, you'll get an ibuprofen level or ibuprofen amount of 750 milligrams. And with acetaminophen, it's going to be 1,500 milligrams, which is less exposure than if you use the products on a daily basis alone, where ibuprofen OTC could go up to 1,200 milligrams and acetaminophen alone could go up to 4,000 milligrams. So there you could see the maximum daily exposure is a good bit less with the Advil Dual Action compared to either of the individual ingredients alone.
Yeah, I mean, my biggest takeaway from that is Advil's just the top of the top when it comes to having to manage any sort of pain. And as you mentioned, there's a few different sub brands of Advil that you said, the Dual Action as well as the Advil PM, that if it's specific to those categories that you just mentioned, that folks can employ those. One of the things that I wanted to also talk to you about is that there's some topical options as well for pain relief. Can we talk about those, Richard?
Yeah, and thanks for asking about those options, Josh. Yeah, there's some great ones. One of them that we're very excited about is Advil Targeted Relief, which we launched last year, and it's our first topical Advil product in the U.S. And it has 4 active ingredients. It has camphor, menthol, capsaicin, and methyl salicylate that work on different nerve pathways to help manage your pain. And it's of the leading topical products in that space, it's the only one with 4 ingredients. So it brings some nice characteristics. And with those 4, they can go down slightly different pathways to give you, again, kind of a multiple ways of approaching the pain within one product with those different ingredients that have slightly different pathways they address. It's indicated for things like sprains, strains, other kinds of common injuries and pains that you're going to encounter. So it's a nice product. It's can be used every 8 hours. So it gives you some convenience there to work in your schedule. And again, it's over the counter. So it's a nice addition to the product. The other product we have, which is Voltaren. So some of you may have known it as an RX product in the past. It was the first diclofenac sodium, another NSAID, but a topical one that was switched over the counter. So now available for you to purchase in your pharmacy and again, get the help of the pharmacist or the nurse practitioners or others there in the clinics to give you some direction on how to use it. But different mechanism than Advil Targeted Relief with, again, it's an NSAID, but the nice thing is you get the benefit of it, of a topical with low systemic exposure, but good efficacy to support it, that it works. And the Voltaren is indicated specifically for arthritis and arthritis of your upper and lower extremities. It was studied for knee OA, and it was also studied for hand OA. And those are very common types of osteoarthritis. So we have really good data that shows it works in those both of those models. And it has really nice placement in the guidelines of the experts, the American College of Rheumatology, which is the leading rheumatology society in the United States. They put out an osteoarthritis guideline. And for knee OA, the Voltaren gel or the diclofenac sodium, which is the active ingredient, that's their first line recommendation for knee OA. So it's a nice product with a proven track record in the clinical studies and in recommendations from the experts.
Excellent. As you mentioned, 2 fantastic topical products, that Advil Targeted Relief that has recently been launched, and then Voltaren, as you just mentioned, especially for folks that are suffering from osteoarthritis in the knees and in the hands. So all fantastic options there, Richard. And want to sort of keep going through the body here in a few other areas of pain management that you all focus on. So let's sort of shift from the body pain to the top of the body and the head, and what sort of options are available when it comes to things going on in that part of the body.
Yeah, thanks, Josh. So we'll cover the whole body. One of the nice things is with the mix of products, we can really pretty much cover your common types of pains that you're going to encounter. So again, whether it's the broad use of Advil, the more targeted with some of the topicals, and then the needs for headache, which again is one of the most common types of pain that we're going to encounter. And one of the nice things we have just for really tension headache or some of the mild headaches, we have products, but then also with migraine, which is a much more challenging type of pain to manage. We do have OTC products with a lot of good data behind them. So, going back to Advil, Advil has the base products for your common headaches, things like tension headache, but then it also has a migraine specific product. So it's, you can, if you like the Advil brand, you can stay in the Advil brand. But the other product line we have is Excedrin, which I think a lot of people are familiar with, and it does have a broad set of indications similar to Advil, but I think really people who know it think of it as a headache type medicine, where I think it gets most of its use or a big portion of its use. And that product also has different formats for migraine, which is one of its leading options. But then it also has an extra strength for a little broader type of headache. It has tension headache, which is just acetaminophen and caffeine. The other two that I mentioned come with aspirin, acetaminophen and caffeine, where aspirin and acetaminophen are the active analgesics that are going to help relieve your pain. But caffeine is in there kind of as a really nice booster, which it's been studied and it's proved that it'll make those analgesics about 40% more effective. So combining those products with those different ingredients, it really gives you a strong option for both regular tension type headaches and the more complex migraines. And then lastly, we have an Excedrin PM for people who maybe get their headaches in the evening, or dealing with the headache pain, but also have sleeplessness. So Advil or the Excedrin PM gives you an opportunity there for manage that nighttime headache.
Excellent. So, lots of fantastic options, as we sort of said, to treat all different kinds of pain scenarios that may be going on with patients. To sort of recap, you have the Advil and the subcategories of Advil, you have Voltaren, and you have Excedrin as some fantastic options. And we've had a great discussion on this today, Richard. And I personally think that this episode is going to be one that's extremely beneficial for nurse practitioners, physician assistants, MDs, and all sorts of providers, but as well as patients, and being able to learn a little bit more about these products. And one of the things that I want to do is some resources that you all have available, and talking about those. Can we start with where providers can find additional resources about what we've talked about today?
Yeah, that's a great question, Josh, to allow, the people who hopefully you get a high volume of people watching the podcast today. But
Yes.
if you want, more learning, more opportunity, more resources at your hand, beyond than what we're able to give just in this podcast, which is a lot of good starting information. We have what's called the Haleon Health Partners site, which is our location for nurse practitioners, physicians assistants, physicians, pharmacists, really any healthcare professional. It's pretty traditional, where it has sections about our products. It has information on how you can order samples, how you can get tools that'll be useful both for yourself and for your consumers. Things like how people can assess and understand their pain, that you can use with their patients as a takeaway that they can use and then better understand their pain, or things to empower them to talk about their pain more effectively when they're going to see a healthcare professional or going into the pharmacy to understand the label, and want to be able to have educated questions to make sure they're getting the right product for their pain, and both understand again that idea of benefit risk. We want something to optimally work and be as effective as possible on managing your pain, but we also want to think about the risk, and we don't want to introduce a risk that's not acceptable to your lifestyle or your health overall. So really thinking about and talking about to your healthcare professionals about benefit risk, and obviously looking for something that's got a favorable balance with that benefit risk. But again, a lot of those tools offer those. I think for healthcare professionals, another big one is continuing education. So we support a lot of broad continuing education in the pain space, and with the other products we talked about as well. And from that Haleon Health Partners site, there's links to the accredited suppliers of continuing education that we've sponsored. So you can go and participate in a range of CE to get good education, but to also get the credits you need to support your license.
Excellent. And then as well, you sort of have the individual websites that folks can go to for the products, correct?
Yeah, and that's another great source. It's, more geared for the consumers, and a lot of the kind of information that they're going to want to understand about using the product. Again, that benefit risk for them to understand how it's used, what it's indicated for, how you get the most out of it in treating your pain, but also what are the warnings with the products, and making sure you're somebody who doesn't have one of those, or maybe does, and you need to take a discussion with your healthcare professional to make sure you understand that risk, and is it acceptable or not acceptable, and give you the information to proceed with the product. And then there's a lot of great articles just about things you can do. So, if you're an arthritis sufferer and maybe you're worried about things like diet and other things that can have an inflammatory component, we have articles about foods that have a low anti-inflammatory risk and other foods that have maybe a inflammatory risk, or simple exercises you could do at home yourself to help you get that therapeutic component to balance with the health, the products, the drug products that we can provide, along with the supplements and other treatment options, and just a range of good information that can help you help your patients if you direct them to the Advil site, the Excedrin site, the Voltaren site, how to understand, what they need to know about the product, and then additional information just to learn about their disease state and other things they can do to take this broad, holistic approach. Because I think, there's not ever this, there's, good drugs, there's good non-drugs, but taking really a broad approach, a holistic approach where you combine all those is really the best way, I think, to get a optimal benefit from what you can do to support yourself and manage your pain, and just put yourself in a good place as you age and deal with different things, particularly pain. So, both sites, both for the healthcare professionals with the health partners and for the product sites, there's good information to get that holistic approach to your pain management.
Excellent. And Richard, I think you just hit the nail on the head there, that you all have so many fantastic resources for both providers as well as patients. And I'm looking forward to this episode of the podcast becoming another resource for folks here in the very near future. And can't thank you enough for joining us today. Before we wrap up, are there any last things that you want the listeners or viewers to know? Any final comments that you have that you would like for folks to know about?
Yeah, I think, I mean, with being here with NPACE, it's such a good access, and the importance of nurse practitioners, but the full range of other healthcare professionals, and really use them as a resource, because again, there's good things out there in the OTC space where we are, but there's things that are prescription. There's information maybe that you won't have access to in the pharmacy. So really utilize those healthcare professionals. There's a lot of information that they know that you're not going to be able to find online and other places where you go. So trust them. They're trained. They're really can bring value to your quality of life with the recommendations they can make. So yeah, just thanks, Josh, for you and NPACE for having me on today, giving me the opportunity. Hopefully this was helpful, and hopefully people will have the chance to visit Haleon's site and take use of some of the products. Again, our commitment is health with humanity, so we really put that as top. We want to deliver great products, but we want to do it the right way and really support you and your pain management journey, and getting to where you want to go with your quality of life.
Richard, can't thank you enough, and think that's a great takeaway from this episode. Work with your provider to figure out the best path forward to managing pain. And with that, we want to thank all of the audience for tuning into this episode of the Friends of NPACE podcast. The Friends of NPACE podcast is generously supported by Haleon. They are our presenting sponsor of the podcast. So a big thank you to Richard, to you, as well as the Haleon team, for being our presenting sponsor for the podcast and allowing us to get out some great educational content to our audience. throughout the show and all of the episodes that we have. As Richard also mentioned as well, we discussed several resources that are available to both patients and providers. We're going to have a good list of links and additional resources that folks can find in the episode description on their listening platform. So be sure to go ahead and check that out. And certainly, if you're listening or viewing, we would love for you to leave us a rating and to subscribe to the podcast as well on your favorite podcast platform. So, Richard, can't thank you and Haleon enough for being with us for this episode of the Friends of NPACE podcast. To all of our listeners and viewers, thank you so much for tuning in. We will see you next time on the Friends of NPACE podcast. Thank you, everybody.
Thank you. Thanks, Josh.